and welcome to our short presentation at an awareness level for head injury, triage assessment, investigation and early management of. And what we're going to look at here are the issues of head injury versus brain injury, the assessment process, triage decisions, treatment and care plan. As Total Train, we specialise in relation to the safeguarding of vulnerable people, in particular in relation to challenging behaviour and the use of physical intervention, and we provide full-day accredited level 2 and 3 courses in the management of head injuries for non-medically qualified staff in either education, care or custody settings. So one of the things that we need to look at here is the difference about head injury and brain injury. And some terminology here: a coup injury occurs under the site of impact with an object, and a contra-coup injury occurs on the side opposite the area that was hit. Coup and contra-coup injuries are associated with cerebral contusions, a type of brain injury in which the brain is bruised. For example, a person having hit their head against the wall could have a brain injury, both at the front and rear of the brain, but only show an impact injury to the front, such as the forehead, at the point of contact with the actual wall. A coup and contra-coup injury can occur individually or together. When a moving object impacts the stationary head, coup injuries are typical, while contra-coup injuries are produced when the moving head strikes a stationary object. So often what we find, particularly with intervention techniques, if during the takedown or during the restraint the people fall and they bang their head, they may have a small bit of visible injury to the forehead, but we need to remember that they could actually have some injury not only to the brain on the front, but also to the brain at the rear as a contra-coup injury. So coup and contra-coup injuries are considered focal brain injuries, those that occur in a particular spot in the brain, as opposed to diffuse injuries which occur over a more widespread area. In injuries associated with acceleration or deceleration, but with no impact, for example shaken baby, the brain is thought to bounce off the inside of the skull and hit the opposite side, potentially resulting in both coup and contra-coup injuries. In addition to the skull, the brain may also impact the tentorium, causing a coup injury. And that's the bit there, that's the tentorium. Cerebrospinal fluid, or CSF, is a clear colourless body fluid in the brain and spinal cord. There's about 125 millilitres of CSF at any one time, and about 500 millilitres is generated every day. CSF acts as a cushion or buffer for the brain, providing basic mechanical and immunological protection to the brain inside the skull. So there's the brain, then it swims around in this CSF, and then we've got the actual skull, and then on top of the skull we then have the body matter of the skin, which has the fluids and the capillaries in there. So when we look at the skull, that's the bony structure that forms the head in most vertebrates. It supports the structures of the face and provides a protective capacity for the brain. The human skull is generally considered to consist of 22 bones, 8 cranial bones and 14 facial skeleton bones. At birth, the human skull is made up of 44 separate bony elements, and during development many of these bony elements gradually fuse together into solid bone, for example the frontal bone. And there's the frontal bone there at the forehead. A head injury is any injury that results in trauma to the skull or brain. The terms brain injury and head injury are often used interchangeably in medical literature. This broad definition includes many examples which are listed here, such as hemorrhages and sub or subdural bleeds. These classifications can be further categorised as open, such as penetrating, or closed head injuries. This depends on if the skull was broken or not. Because head injuries cover such a broad scope of injuries, there are many causes, including accidents, falls, physical assault or traffic accidents that can cause head injuries. Many of these are minor, but some can be severe enough to require hospitalisation. So what are the signs or red flags to recognise for triaging a casualty to a healthcare professional? Well, according to the 2014 National Institute of Clinical Excellence guidance on head injury management, Some key triggers here for people to be aware of, particularly in relation to children and infants. For example, a bruise, a swell or laceration of 5 centimetres or more, then the healthcare professional should be considering a CT scan within 1 hour. If this child or infant has panda eyes, then there should be consideration in relation to a CT scan within 1 hour, or any fluid from the ears or nose, consideration of a CT scan within 1 hour. Or the head injury is being caused by a high-speed causation or projectile, for example, a road traffic collision or hit by a thrown stone, and that will also include a punch to the head. A head injury with neck pain from a fall of 1 metre or 5 stairs, then the healthcare professional needs to be considering an X-ray within 1 hour, or a bicycle collision, consider an X-ray within 1 hour. The priority is to assess the presence or absence of risk factors, signs and symptoms, and then triage to the professional healthcare provider by the most suitable means. So head injury, then specific kinds of injuries that they can include, such as skull fracture, lacerations, hematoma, traumatic hemorrhage, cerebral contusion, concussion. A severe injury may lead to coma or death. And also if we look at abusive head trauma, AHT, commonly known as shaken baby syndrome. So AHT, abusive head trauma, commonly known as shaken baby syndrome, it's an injury to a child's head caused by someone else. Symptoms may range from the subtle to the obvious, and symptoms may include vomiting or the baby that will not settle. So this is where a person has shaken a baby or a small child, and then the brain is damaged and injured, although there is no visible injury to the head. Often there's no signs of the trauma, and complications include seizures, visual impairment, cerebral palsy and cognitive impairment. The cause may be blunt trauma or vigorous shaking. Often this occurs as a result of a caregiver being frustrated due to the child crying, and diagnosis can be difficult as symptoms are non-specific. It occurs most frequently in those less than 5 years of age, and the risk of death is about 25%. A risk in relation to shaken brain is in relation to interventions, physical interventions with children or adults, even though there's no impact to the head. If the person is shaking in between the restrainers and they're being violent with their head moves, they could actually have brain injury. Assessment by a non-medically qualified person then, so a first aider in an education, care or custody sector. If you are that first aider for a child or vulnerable adult or elderly person, you have a duty of care for them and legal obligations under the Health and Safety at Work Act to assess for risk, eliminate that risk or reduce that risk to its lowest level. You also have obligations to safeguard your service user and to this extent to provide safe and effective care. Head injury assessment is complex and errors could prove fatal or life-changing. You are not a specialist in head injuries to confirm the presence or absence of brain injury. It's essential to understand red flags and criteria for recognition of potential risks and decide a triage option, such as divert to a healthcare professional. So if a healthcare professional is guided to consider a CT scan for a bump of 5 centimetres on a young child, then you should be looking for a bump of 5 centimetres or more. So let's look at some of the criteria again then. Bruise, swell or laceration, 5 centimetres or more, panda eyes, fluid from the ears or nose, a high-speed causation or projectile injury, or any neck pain from a fall of 1 metre or 5 stairs, or a bicycle collision. Point of note, a head bump, which is often used to refer particularly in childcare settings, so a head bump without the fracture of the skull can indicate a traumatic impact to the skull, which may therefore have caused a bleed or a swell on the brain. So with a head bump, we've got a head injury and we may also have a brain injury. But what is ruptured and swollen, which is what you can see in the head bump, is the skin and body fluids on the outside of the skull. Any reduction in swelling of this area does not mean that there is no bleed or swell within the brain. Interference with a visible red flag may negatively influence the triaging of the casualty to a healthcare professional in the mistaken belief that there is no brain injury and subsequently cause life-changing injuries or death. Then if we look at our assessment of risk and care planning and safer systems of work in order to eliminate or reduce, we're able to provide templates for education, care and custody sections to be able to assess the level of risk. And also if we're looking at the 4 categories of assessment, triage, treatment or aftercare and care plan, we've talked about some basic assessment and triage issues. Treatment wise, the National Institute of Clinical Excellence Guidance 2014, which was last updated in 2017, recommends that pain relief is by medication and it's prescribed by a healthcare professional. Note, as first aiders, you are not trained or authorised to prescribe medication for pain relief. Refer to your administration of medication policies and guidelines and best practice. Also then if we look at the aftercare and the care plan, following the assessment, triage, decision and treatment plan, a care plan should dynamically be agreed to include observations and rousing procedures. The first 4 hours is the first critical time of observation, up to a total of 24 hours, and then that may be beyond. Each workplace of service provision will have their own unique risks. For example, people may be more susceptible to head and brain injuries if they are young or old due to capillary weakness. Alcohol and drug dependency service users will also be more susceptible. Challenging behaviour service users may sustain shaken brain during interventions. It's essential that staff recognise the risks and safer systems of work for recognition and triage of the service user to the healthcare professional for treatment and subsequent care plan. For further information and regarding training in relation to head injury management in your specific sector, then please do not hesitate to contact Total Train. We're safeguarding vulnerable people in the education, care and custody sectors. Thank you.